CIR's Family Health Challenge, FHC, is a valuable program that benefits both resident physicians and the school community. By sharing health information and skills with elementary school students, doctors contribute to improving health outcomes, strengthening community bonds, and engaging actively with their union and colleagues. Throughout this video, we're going to give you all the information you need to prepare for your participation in the program. All of the FHC lessons are on the CIR FHC webpage, broken down into individual folders by week and clearly labeled. Each lesson includes a slide deck with the slides that you will present in class, facilitator notes, and any supplemental videos and resources that you need for the lesson. Each lesson has a similar structure and look. It starts with you introducing yourself and sharing a fun fact. Then there is a short movement exercise before beginning the lesson of the week. Each lesson includes an activity, and some lessons have giveaways at the end for students. The lessons are designed to be fun, so be sure to bring your personality and put your own spin on it. It's okay if you get stuck or need support. The classroom teacher is there to help you if needed. Give yourself enough time to review the lesson in advance. A few days before your session, access the materials. Make sure you understand the content and activities so that you feel comfortable leading the session. Review the slides and the facilitator notes. Go through the steps for the activity so that you can give clear instructions to the students. If you have any questions about the lesson content or activity instructions, ask CIR program staff or a fellow FHC doctor. Prior to the lesson, you will be connected to the other FHC doctors that will be co-leading the lesson with you. One to three doctors will facilitate the lesson together. Be sure to coordinate how to divide up the lesson so everyone has a chance to engage with the class. On the day of the lesson, be sure to wear your white coat and/or scrubs. Plan to arrive 20 minutes before your lesson is scheduled to allow time for travel delays and to find the classroom. Check in at the front office when you arrive to the school. In the classroom, greet the students and the teacher. The slide deck should be up on the screen and the students should be ready to learn. Ask the teacher what behavior management techniques are helpful in the classroom and use accordingly. When it is time to start the lesson, show your excitement. Evidence suggests that talking in an enthusiastic tone during a lesson actually increases learning during that span of time. So project your voice, speak clearly, and share all the information you know. The students really want to hear from you. Start by introducing yourself and sharing a fun fact. Of course, include that you're a proud member of CIR. During the activity, students might be working in small groups. Walk around and engage with the students. We can learn so much about the barriers students face when we talk to them one-on-one. This is where the magic happens. The slide deck is designed to be your guide. The slides provide you with visual prompts. You can also print the facilitator notes or have them on your phone for reference during the lesson. The more you familiarize yourself with the lesson in advance, the more comfortable you will feel leading it. After explaining the instructions for the activity, take time to model the activity with your fellow doctors. This will help students feel clear about how the activity works. Leave time for questions. When the group needs to come back together, use classroom management techniques that the teacher normally uses with their students. If there is a challenging classroom dynamic, or if you feel unsure about what to do, ask the teacher for input. You can also rely on your fellow CIR doctors for support. You've got this. As the lesson draws to a close, save a few minutes for Q&A. Sometimes, students can ask challenging questions. If you don't know the answer, it is totally fine to admit that you do not know. You can direct your students towards another source of information, such as a teacher or family member, or you can promise to answer it during the next lesson. Debrief with your FHC colleagues to discuss what went well, lessons learned, and ideas for improvement next time. Share this feedback with CIR's Community Relations and Engagement Coordinator by text or email. Your reflections about the lesson and your experiences are valuable input that will help us refine our materials and develop new resources for participating doctors and school communities. You will also receive a completion letter at the end of the program that will be sent to you and your program director. Look out for yours.